Hello, my name is Alex Gornitsky from the University of Michigan, and today I will be teaching you about toe walking. Toe walking is a pattern of walking where children and adolescents walk up on their toes and do not place their heels flat on the ground. There are two types of toe walking. The first is idiopathic toe walking, also known as habitual toe walking. This means that there is no medical reason why your child walks on their toes. This form of toe walking usually involves both legs. The second type of toe walking is due to an underlying medical cause. This may be due to an underlying difference in their brain, nerves, muscles, or bones. Importantly, while toe walking can commonly occur on one or both sides, single-sided toe walking at any age often is associated with an underlying cause and may require further diagnostic workup. Looking at timelines, some children begin walking up on their toes as soon as they first learn to walk. After that, most kids develop a normal heel-toe pattern of walking by 2 or 3 years of age. Persistent toe walking after 3 years of age should be evaluated by a pediatrician or orthopedist. Additionally, toe walking that starts at a later age, for example after a child has been walking normally for many years, may require a more detailed workup. The majority of children who toe walk have no pain. They can play sports and participate in all normal activities. Many are even able to put their foot flat on the ground when prompted. However, toe walking is an awkward way to walk and run. They may tire more easily, or they may complain of some foot and leg pain after a lot of walking or play. Unfortunately, if children continue to walk up on their toes for many years, they may develop permanent tightness in the muscles and tendons of their leg that prevent them from being able to put their heels flat on the ground while walking. Therefore, the goals of treatment are to address toe walking before the muscles and tendons of the foot and ankle become permanently tight. When you see your physician, he or she will conduct a full history and physical examination. They will watch your child stand and walk, and will assess range of motion of the hips, knees, and ankles. Finally, they will conduct a full neurological examination. If there is anything concerning on history or physical examination, then your physician may recommend referral to a neurologist or developmental pediatrician to look for a potential underlying cause of the toe walking. For most kids, radiographs or diagnostic imaging of any kind are not indicated in the routine workup of idiopathic toe walking. Moving on to treatment, toe walking resolves in most kids without any treatment by age 10. If toe walking persists past that age, it may be due to an underlying contracture in the Achilles tendon or calf musculature. There are many different treatment options available for children who toe walk. The specific recommendations your physician makes will be influenced by how old your child is and how stiff their muscles and tendons are. Some of the most common treatment options include observation, home stretching, formal physical therapy, bracing, serocasting, and surgery. And we'll take a moment now to briefly go over each of these different treatment options. Starting with observation, children who toe walk out of habit and not necessarily muscle tightness may eventually stop on their own or with frequent reminders. For these children, stiff-soled shoes may help to encourage a proper heel-toe gait. Depending upon how flexible your child is, your physician may recommend daily stretching exercises, and these can either be done at home or with a formal physical therapist. For more severe contractures, braces may be recommended to maintain the foot and ankle in a stretched position. Most often these are night braces, but daytime braces such as ankle-foot orthoses may be recommended for children with underlying neuromuscular or sensory issues. When the previous options fail, or when a child is older with very severe toe walking, your physician may recommend serocasting. This involves applying a new walking cast every 1 to 2 weeks in a new position to progressively stretch the calf muscles. Casting is complete once the stiffness has improved and your child can bend their ankle past 90 degrees. For children with bilateral toe walking, casting can be on one side or both sides at a time, per family preference. Most children with idiopathic toe walking do not need surgery. If surgery is needed, it will be targeted to the part of the muscle and tendon that is the tightest. A cast will then be applied to hold everything in a stretched out position while it heals. Rehab begins once the cast is removed. Although surgery can completely correct the deformity, it has a longer recovery time and may permanently weaken the muscle, so it is only recommended in limited circumstances. Looking at outcomes, there is no evidence that toe walking causes serious long-term issues such as pain, arthritis, or ambulatory dysfunction in adulthood. More often, it can cause simpler things like skin calluses, stress fractures, muscle fatigue, and foot or calf pain. Regardless of the treatment chosen, toe walking may recur as children continue to grow and their muscles can get tight again. If tightness does return, It can often be treated with another round of therapy or casting. Thank you for your attention, and please check out orthokids.org for more information.